Hi, I'm Kate Marie and I'm from Slow Aging, and today I'm here with Dr. Jason Kaplan, who's a cardiologist and he works at Macquarie University. Hi Jason.
Hi Kate, how are you?
Great, thanks for seeing me. I'm really excited about this consult.
Great, it's a pleasure.
I've come armed with a few tests. I know this is not the normal, from woe to go consult, so I'm keen to see, I'm over 50, I'm keen to see what I can do to prevent heart disease. My family, the grandparents in my family all died of heart disease, and apparently I have a slight genetic predisposition. So I'm keen to see what tests I can do and particularly what lifestyle interventions I can do to prevent it, and then how will I know I'm at risk at a certain stage, because I know that typically it creeps up on you. So I want to know, is there a way I can see where things are starting to decline right from the start?
So I get a very good comprehensive idea about what your risk is by taking your history, some of the tests that you've brought in, including the blood tests, and a test called a stress echo, which we'll do later on. So the first thing, Kate, is you told me you've got a strong family history of heart disease. Who in the family's got heart disease?
They're all dead. My grandparents on my mother's side, I think, died of heart disease, and on my father's side, my grandfather died of heart disease.
One of the most important things is, that we can't really change our genes. To a large extent, we can't. We have control over environment. So in a way, I tell patients the genes is like loading the gun, but the environment pulls the trigger. So we do have some control, even if we have a really bad family history, and especially in those people, you need very, very good early detection, because then we can institute preventative strategies. You don't smoke at all, do you?
No, I did when I was younger. Does that set me up for risk when I smoked when I was younger? Well, no, even up till I was about 35.
No,
of social
not necessarily.
Smoking. Okay.
Though interestingly, atherosclerosis, or the disease that causes the most coronary disease or blockage to the blood supply to the heart, starts very early. We know from studies that it actually may start in teenage years.
Wow.
So very early fatty streaks are seen in people's aortas from very early on in life. So Kate, you've brought some cholesterol tests. Your cholesterol is actually very good. Your total cholesterol is 4.6. Your bad cholesterol, which is your LDL, is 2.6. And your good cholesterol, which is called your HDL, is 1.8. Now the bad cholesterol takes cholesterol from the liver to your blood vessels, while the good cholesterol, the HDL, takes cholesterol from your blood vessels outside and excretes it from the body. So the higher your good cholesterol is, the better, and for the bad cholesterol, the lower it is, the better. And for most people, like to see people's cholesterol under 5.
Okay.
But the really important thing about cholesterol, we like to know what's happening in your arteries as well. And we'll talk about your calcium score on the next test. One of the things that's very important to know is your blood pressure. So what I like to do, Kate, for blood pressure is I use a test called the sphygmocor device. Now this device not only measures your blood pressure at your arm, it's from your brachial artery, which is where most people test it, but it measures your blood pressure as it's coming out of the heart, which is a very true reflection of your blood pressure, and also how stiff your arteries are. You can imagine if you have very diseased arteries, your blood vessels become very stiff. And if you're healthy, your blood vessels are very elastic, and we can get an idea of your arterial age as well.
So this is called pulse wave analysis. And is this the sort of test you should have regularly?
Once every few years.
Yeah.
So the great thing about this test, this was actually from research done in Australia by Dr. O'Rourke at St Vincent's Hospital, and it's an Australian company, and it's validated in thousands and thousands of patients about how high your blood pressure is, exactly how it's coming out of the heart, which is a much more true reflection of what your real blood pressure is.
So what's the ideal score?
So we get the ideal score based on both your height and your age, and we'll see a range for you right now. So ideally you want your central blood pressure to be within a normal range, and you'd like your arteries to be elastic and compliant.
Yeah.
The stiffer your arteries are, the greater the risk of developing high blood pressure down the track, and interestingly, the greater risk of stroke.
So because if they're stiff, the blood's not going to go through, it tends to gel.
It can, but also the stiffer your arteries are, the greater risk you are. And as we get older, especially at the age of 50, high blood pressure becomes a very important cardiovascular risk factor. So Kate, I'm really glad this has come about, because you have very healthy arteries.
Oh, good.
Your central blood pressure is well within the normal limits, actually under, so it's a great reading. Your arteries are really elastic for a woman of your age and really compliant, suggesting very healthy arteries. And in actual fact, your arterial age is of a woman much younger than yourself.
How old?
Probably in their 20s.
Oh, fabulous. At least something's not aging.
I think one of the important things to note, although there are lots of other metrics that people look at to look at cardiovascular risk these days, and as you mentioned, there are various types of blood tests. We need to not forget about the really important metrics. Now, those metrics include, blood pressure, blood sugar, so it's important that whether you have diabetes, and I know that you don't have diabetes, whether you're a smoker, what your cholesterol level is, and what your weight is, and also I always ask people about diet as well. Right. So what's your diet like?
It's not as good as it should be. I do focus on having lean protein, very little meat. I travel a lot, so I minimise. I've got minimal fruit or sugary fruits, and I try and keep my vegetables together. My biggest thing is cake, and carbohydrates like cakes. But then I try and eat organic cakes, and I try and eat gluten-free. But yeah, so it's okay. My diet's pretty good. It's not perfect. I'm not like a Nazi with my diet, but it could be improved, I think.
I always ask about diet because the Mediterranean style diet has been a diet that's consistently been shown to reduce cardiovascular events. There's a very large study called the PREDIMED study that was published in the New England Journal. PREDIMED that showed that if you had a Mediterranean style diet with plenty of nuts and olive oil, you reduce your risk of cardiovascular events by 40%.
40.
Which is almost like taking a small dose of a cholesterol-lowering drug like a statin.
Yeah.
Imagine if that combining it with exercise.
But that's not with all the pasta and...
That's not with all the well, it's whole grains and mostly unprocessed foods.
Yes. Okay.
So limited red meat, limited sugars, but more whole grains, lots of fruit and vegetables. Yeah. And if you Google the Mediterranean style diet pyramid, you'll get lots of information about it. Now, the other really important thing, you said you do a lot of traveling. Just published recently was something about the social business style of eating, as opposed to a more Western diet versus a more Mediterranean style diet. And it's found that people who have a social business style of eating actually have more coronary plaque and more atherosclerosis than people on a Mediterranean diet. Yeah. So the way that our food, how we eat it, and what we eat plays a major part in our risk of heart disease. So the other test that you have brought today is your coronary artery calcium score. Okay. So now the coronary artery calcium score is probably the most useful test we have at predicting your cardiovascular risk. While a lot of what we've talked about before is just about numbers, your coronary artery calcium score takes a snapshot of your arteries and looks for the presence of plaque in the artery wall. And I liken it to trying to tell what the weather's like without looking outside. Because you may have absolutely perfect numbers, but there may be hidden plaque, lining the walls of the arteries, which puts you at risk. And this is why a lot of people present with heart attacks without any sign of a heart attack before. And using a test like the coronary artery calcium score, we can pick up very early signs of heart disease and be very preventative about it. So the great news is with yours is that your calcium score of 0. Okay. So a calcium score of 0 means there's no long-term calcific plaque or long-term plaque, but also that correlates to a very low risk of a major cardiovascular event over the next 7 years. So people with calcium scores of 0 have a very good cardiovascular prognosis, provided you don't go eat junk food and stop taking care of yourself and start smoking. Your calcium score, great is 0, but calcium scores can go up anywhere from 0 to over 1,000. The higher your calcium score, the larger the amount of atherosclerosis that you have, and the different amount of recommendations that we would make for you. Now, when I have all that information, Kate, I can get an idea of your total cardiovascular risks. What I usually do for patients is I put it into a risk score calculator, and I incorporate your calcium score into the risk score calculator, which will give me a very accurate number about what your risk of a major event is over the next 10 years.
So with that risk, what calculator do you use?
I particularly use a calculator that's called the multi-ethnic study of atherosclerosis. Right. But many people use different calculators, and there's the Australian New Zealand cardiac risk score calculator, and the largest one is called the Framingham, which is mostly an American data. Each risk score calculator has its own limitations. Some don't include family history, which is actually very important. The other really important thing to note is about some of them don't include ethnic origin as well. Though this study, the MESA study, does. And I'll show you what it's like, and we'll put some of your information into it. So we put in your age, we put in your calcium score is scored in Agatston units. Arthur Agatston was the founder, is a cardiologist in Florida. He invented the South Beach diet, and he also did work on the calcium score. For you, we will put a family history. Unfortunately, this calculator uses milligrams per deciliter, which is a different unit. So we're going to convert that. We times it by 40. So when we put your 10-year risk for any major cardiovascular event, including your calcium score, it lies at 1.2%. So this is a very low risk. Interestingly, your 0 calcium score suggests that your risk is actually even lower than if we didn't have the calcium score in. So overall, Kate, you're pretty low risk for any major cardiovascular event.
Cool.
So what you're doing great. As part of my evaluation of people, I also like to get an idea of what their functional capacity is, what their exercise capacity is like, because all these numbers may look good, but if you can't exercise, if you're very unfit, you're not going to live a long time. Yeah. And that holds true, especially as we get older. And it's been very well shown that your fitness in your 60s is directly correlated to longevity. So for all, and because I believe so strongly in the power of exercise, now tell patients, if I could prescribe one drug for you, exercise would be it. And the reason why I would suggest a stress echo, especially in a woman of your age, is because we get to see the heart in real time. And even if you have the test once, we get an idea to see what your heart function is like. We look at the valves, but also if we just use the stress ECG or the electrical tracings by themselves, especially in women, we sometimes might get false positive readings. So for women, I think a stress echo is a much better test. For men, you may just be able to use the stress ECG test. So we're going to go and do that. I'll get an idea of what your functional capacity is, make sure the heart is functioning well with exercise, and then we'll come back and talk about the results.